You mentioned that you had a 3-year-old little boy who's had so many ear infections in the past that it's affected his speech development. And this can happen because it can affect a child's ability to hear, and that affects their language development. And so with time, this should be remedied. And if you haven't already, talk with your pediatrician about the need for speech therapy. Early intervention is key. If this is necessary, it will help him just be back on track as he gets older. Now, for your 1-year-old, you want to make sure that this doesn't happen to her, and you want to know what the signs are, how you can prevent it. Ear infections are actually very common. About 3 out of 4 children get one by the time they're 3 years of age, and so it's a very typical childhood illness. It's usually caused by a virus that causes the common cold. It's usually a secondary infection, so a child will get like a cold or something, and then it can turn into an ear infection. Sometimes it's also caused by abnormal bacterial growth as well. So if we refer to the cause, that's going to help us determine how we can prevent it. So like in the case of a common cold, the best way to prevent the spread of illness is to wash your hands and wash your children's hands frequently. Teach them to wash their hands with warm water and soap for like a good 15 seconds. So scrub every square inch of their hands. And you can make it fun by telling them to wash as long as it takes to sing happy birthday or the ABCs. And if you're out and about, then you use an alcohol-based hand sanitizer when hand washing isn't possible. Especially do this after they've touched things in a public area or before they're going to eat, of course after they've gone to the bathroom. All of those things are good times to teach kids how you should wash your hands. There are a few other things you can do to reduce the risk of ear infections. Babies who drink bottles versus sippy cups are more likely to get infection because there's more surface area on the inside of a bottle, and that means more opportunity for bacterial growth. So if your 1-year-old is still drinking a bottle, then think about transitioning her to a sippy cup. Avoid exposure to secondhand smoke. If you breastfed her during the first year, then her chances of getting ear infections are lower. And it's also very important to give your child a flu shot and to keep them up to date on vaccines. If you notice that she starts to develop symptoms of an ear infection, like she's tugging or pulling at her ears, she's acting irritable, she's not eating well, maybe running a fever, if she's complaining that she has a sore throat, because sometimes they misinterpret ear pain for being throat pain, talk with your pediatrician. I mean, your son's had them, so you know what his signs were, and then the pediatrician will look in her ears, ask you more specific questions, and decide if she does indeed have an infection and if treatment is necessary. If you have more questions for me in the future, please feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.